1, 2. Good afternoon and welcome to our topic, multiple sclerosis in the Black community. I'm Tamara Brock and I am Head of Partnership Development at Black Health Matters. We're so glad you're here today. Recent research conducted by Kaiser Permanente and published in the journal Neurology contradict the widely believed notion that Black people are less vulnerable to multiple sclerosis. The electronic health records of over 3.5 million members of Kaiser Permanente, Southern California, were analyzed from the beginning of 2008 to the end of 2011. And a total of 496 newly diagnosed patients with MS were identified. And of these new cases, Black patients had a 47% greater likelihood of MS compared to white patients. Our expert will dive deeper into what the Black experience is like for people living with and caring for those with MS. Our guest today, Dr. Mitzi Joi Williams, is a board-certified neurologist and fellowship-trained multiple sclerosis specialist who serves as the founder and CEO of the Joy Life Wellness Group Multiple Sclerosis Center in Noonan, Georgia. A subject matter expert in neurology, multiple sclerosis, and health disparities, Dr. Williams has over 15 years of experience in the field of MS. Welcome, Dr. Williams.
Thank you so much for that wonderful introduction, Tamara. And thank you so much to the Black Health Matters organization for inviting me to speak about this topic that's extremely important and near and dear to me. So I am going to go ahead and share my screen and we'll do a brief presentation and then we'll open it up for some Q&A at the end. All right, perfect. Okay. Okay, so give me just a second. Let me try to share my screen again. Okay, here we go. All right, so let's talk a little bit about MS in the Black population. I am an MS doc that lives in Atlanta, Georgia. So Noonan was one of the locations of my clinic, but everybody's right outside of Atlanta, but nobody actually lives in Atlanta. So thank you for taking your time today, and let's just dive right in. So what is multiple sclerosis? So MS is what we call an autoimmune disease, meaning the immune system, the part of the body that normally attacks viruses and bacteria, gets confused and attacks a good part of the body. The part of the body that's attacked is the coating of the nerves, and it's a substance called myelin. So if we look at this slide here, we can see this kind of, I don't know what color it is, orange, kind of fatty coating here. But this basically makes the electrical signals run quickly. So I think about it like insulation in a wire. So if I have my wireless headphones and one of my kids gets a hold of them and damages them, then in some cases they may work a little bit, in some cases they may have a short, and then if the damage is severe, they won't work at all. And that's essentially what happens to the nerves with multiple sclerosis. But multiple sclerosis is so much more than a clinical definition. It affects people, right? It is different symptoms that can affect a person's function, its community. And there's so much more than just the symptoms that we see. One thing that's really important to emphasize here is that if we see one person with MS, we've seen one person with MS. So everybody's very different in the way that they present or have the start of their symptoms and the way that they change over time. So what about multiple sclerosis in the United States? There was a recent study that suggested that there are nearly 1 million people in the US living with MS. And the reason this is important is because prior to this study that was published in 2019, we did not have accurate numbers. And so we were just kind of shooting in the dark. And before that study came out, we actually were saying that there were 400,000 people in the US with multiple sclerosis. So that research actually suggested that there was double the number that we were previously thinking that are living with this condition. And when we think about the face of MS, Tamara brought up this amazing study that I'm going to mention a little bit here in my talk as well. But the face of MS is changing. So when many of my older colleagues, and even when I was coming along in my training, we learned that MS was a young white woman's disease. But many of the people with MS that I'm diagnosing these days look like the young woman in this picture. And the study that was published by Kaiser suggested that the incidence of MS was highest in Black people, and that the risk may be 47% higher in Black people, but that was primarily driven by the higher incidence or risk in Black women. And this is just another slide that tries to illustrate that. So I know you can't see the bottom part, but this first part here on the left is the total incidence, right? And incidence means the number of people per 100,000, right? So we can see the green line, which represents the Black population. The blue line represents the white population. We can see that overall, the incidence is higher in Black people. Okay, but we can really see that difference come out when we look at women, which is this middle category here. So you see a pretty significant jump between white women and Black women, but we don't see quite as much of a difference in men. So a little bit higher risk in men, but certainly women, Black women seem to be driving primarily the higher risk that we see. What about the clinical characteristics? So we know that MS, it can present or manifest a little bit differently in Black people. Disease progression seems to be faster. There's more damage to the brain and shrinkage of the brain, and also faster shrinkage of areas of the brain that can affect our cognition or our thinking. There are other studies that suggest that there's an increased risk for needing some type of assistive device to walk, like a cane or a walker, up to 6 years earlier in Black people than white people. So we know that the outcomes, much like we see with many other conditions, can be a little bit worse in the Black population. And then this study is a very striking one that I usually put in all of my presentations since it became available. That was published by a good friend of mine, Dr. Liliana Amescua, in 2018. And it actually shows that the mortality is higher in younger people for Black people with MS. And so we can look at this graphic here, and NH means non-Hispanic. But when we look at the blue line, which is non-Hispanic white, we can see that overall, the risk of mortality is higher in white people. But when we look earlier on, especially starting at that age 15 and going up to about 40 to 45 here, we can see that the orange line, sorry, I was trying to use my mouse. We can see that the orange line is actually the highest, and the orange line is non-Hispanic Black people, okay? So it's not just a matter of more significant or more severe outcomes, but in some cases, the mortality may be higher at younger ages, suggesting that people have more disability very early on. So a lot of people say, hey, Dr. Mitzi, maybe we have worse outcomes because we can't get to the doctor in time. And so certainly one of the big issues that we need to better understand is, how does the biology part work in conjunction with things like what we call social determinants of health, being able to have access to the doctor, having access to a specialist, having health insurance, et cetera. And so this was a study that was published looking at all neurologic diseases, including MS, and showed that Black people were 30% less likely to see a neurologist for their neurologic conditions, right? Which is concerning because neurologists usually know how to treat these things appropriately, as well as help treat symptoms, particularly for MS. All right. And then there was another study specifically focused on MS that also suggested that we were less likely to be able to access neurologists. And this is not even including specialty care. So this is just a general neurologist. And this is an interesting study that I just recently read that was published in 2020 that talked about the experience of Black women with multiple sclerosis. And many of the women who were interviewed in this focus group for this study felt that healthcare providers were reluctant to consider a diagnosis of MS, which is extremely important. So there not only needs to be education in the wider community, but also in the physician community to make sure that people know that the risk is higher in African Americans, that we need to be considering MS when people come in with symptoms that are very typical of multiple sclerosis. Now, let's dial back for a minute and say, what does it mean to be Black, right? And so this is one of the questions that's very difficult to answer from a scientific basis, right? So when we think about race, race is really what most people describe as a social construct, right? But when we look at things on a genetic level, most people that describe themselves as African American or Black have about 20% European ancestry genes and about 70 to 80% genes that are African ancestry, but when we talk about our research studies, et cetera, It's basically by self-identification, right? And we've had several instances in the news over the years where people have said they were Black and everybody thought they were Black, and then we found out they weren't Black, right? So we have to find a better way to analyze really and look at ancestry instead of just looking at race and outside characteristics. Which leads me to this paper I was very fortunate to be a part of that talks about MS in the Black and Hispanic communities. And what we found is that when we did a literature search, right, to try to understand why we saw some of these differences related to MS in these populations, we found that less than 1% of the papers published on multiple sclerosis, and at that time in 2015, there were about 60,000 papers published in English about multiple sclerosis, and a little over 100 were about Black people, and less than 25 were focused on Latin American or Hispanic Latino populations. So those numbers have increased some, but they still represent just a small amount of the literature and information that we have about multiple sclerosis. So why is it important to talk about research? And so this is one of my passions, to talk about the underrepresentation of certain groups and certain people in our clinical research. It's because there are sometimes differences that are cultural, environmental, or physiologic or biologic that we may miss. And then the other question is, if everybody's not a part, how do we generalize these findings, right? How do we know that the end result applies to everybody if everybody is not included? This was a very great group that I get the opportunity to work with, called the MS Minority Research Partnership Engagement Network. And we did a study and surveyed close to a little bit over 2,500 people living with MS. 2,000 of them were white. We had a couple of hundred Black patients and almost 200 Hispanic Latino patients. And what we found was that many people had positive attitudes toward research. The Black and brown groups did have some issues concerning trust with research, concern about receiving poor quality care, and as well as health insurance. But two of the major barriers to being involved in research were people didn't know where to find out about studies, and their doctors did not ask them to be involved in clinical research. So again, there needs to be a lot of information and education in the physician and healthcare community to increase diversity in clinical trials. So despite all of that data, some of which seemed very bleak, I am very hopeful for the future, all right? There's a lot of amazing stuff and a lot of great work that's going on to try to bridge these gaps and better understand MS in the Black population. So number one of the things that I like to talk about a lot is what you can do to help yourself. You meaning a person who is living with MS, or you as a care partner, or a loved one, or a support system for someone living with MS. One of the things that I love to emphasize is that you are your own best advocate, right? So learning about the diagnosis, learning about treatment options is extremely important. When you go to the doctor, understand the treatment plan to the best of your ability and try to stick to it. And if you're having issues, let your healthcare team know, because we need to come up with a new plan if the one we have is not working. Also, doing things like incorporating a healthy diet and exercise into your routine is extremely important. Also, talking to your healthcare team if you have issues, if you have questions. I encourage my patients to come with lists. So they come with lists either on a notebook paper, and an old-fashioned calendar, or in their smartphones. Or sometimes they may bring a care partner or a loved one who is their mental list of issues or concerns that they have, and we try to address as many of those as we can. Find your support system. Support is very important for people living with multiple sclerosis, because oftentimes you have to ask for help, which leads to number 6, ask for help when you need it. Don't be afraid to do that. And remember, again, that you are your own best advocate. All right. So what else can we do? Maintaining brain health, right? So other things that you can do. Brain health is a really hot topic and extremely important, because brain health leads to better overall health. And again, if you're dealing with a condition like multiple sclerosis, it's important to have your brain and your body as healthy as possible, so that if you have an issue, you could likely recover more quickly. So physical activity, whatever that looks like for you. I often encourage people to reframe their thinking about exercise. It does not have to be putting on your Nike suit and going and, running for an hour and pumping iron for an hour, doing aerobics for an hour. Maybe it's walking to the mailbox and back a couple of times a day. Maybe it's parking farther away at the grocery store and getting those extra steps in to go to the store. So there are all kinds of ways that we can adjust our physical activity. A healthy, well-balanced diet is also important. I get lots of questions about that. There's not a particular diet that necessarily makes MS better, but certainly I've had patients that have done a variety of diets, from anywhere from paleo to the Walls Protocol to, vegan or what have you. The main thing, the underlying thing with all of these diets is really to eat more raw, fresh foods and less processed. Okay. And then, of course, stopping smoking. If you're smoking cigarettes, because cigarettes do increase the risk of relapse with MS and also speed the progression of MS from relapsing remitting disease, where you have symptoms that come and go, to more progressive disease. And then limiting alcohol intake, because extreme use of alcohol can cause damage to certain areas of the brain over time. All right. And then making sure you have a primary care doctor to treat other medical conditions. So what are some of the exciting initiatives? And I'll spend just a few minutes on this as we're kind of coming to the end of the presentation and ready to open up for Q&A. There's a group called the Minority Research Engagement Partnership Network, of which I'm a part, and we have people living with MS of a variety of backgrounds, Hispanic, Latino, as well as Black. We have researchers, we have people who are part of industry, people who are part of our advocacy groups like the MS Society, the MS Foundation, the MSAA, and also I Conquer MS. And so all of us come together and try to find ways where we can better understand research participation, educate people about the research process so that at least they can make educated decisions if it's a good thing for them or not. And we also try to dispel myths about research so that people better understand the process. There also is the first minority-focused clinical trial in multiple sclerosis. I'm the head of the steering committee, the lead investigator for this trial, and it's called the Chimes Trial. It is focused on a medication that's already approved for MS, but again, is a breakthrough in terms of us trying to understand how MS behaves and some of the underlying biologic changes that may be different in Black and Brown populations. And also, I'm very pleased to be one of the founders of the National African American Multiple Sclerosis Registry. This is something that has been 10 or more years in the making. And essentially, we're trying to better understand MS in the Black population. It's a survey that people fill out. Once you register for the website, you can see the website here at the bottom of the screen. You can register, and then we also periodically send out information about MS. We send out educational tools, and we are about to present our first research poster at a national, or actually at an international meeting coming up next week about the first 100 people that have registered. So I encourage you or your loved ones to check it out and register if you feel compelled to help understand the community. And then finally, you can stay connected to me. I do a lot of work focused on MS. I have a Facebook page, Instagram, YouTube, and I'm on Twitter a little bit, not too much, but I'm the nerdy neurologist. And so I love to provide educational opportunities to help people better understand this condition and to take control of their health. And with that being said, I think I finished with a minute to spare. And my favorite slide that I end every talk with is, all I need is peace, love, and a freaking cure for multiple sclerosis. Thank you so much for your time and your attention. And I will go to some of the questions, which I see the Q&A box is filling up. Okay, so we'll start with the first question here. And here, give me a second. I will stop sharing my screen. Okay. All right. So I will start with the first question here. So someone asked, what are some of the symptoms of MS and how do you know when to get tested? So this is an excellent question. The symptoms of MS are very different in different people, but some of the most common issues that people have are things like visual change or loss of vision. So some people will wake up and not be able to see out of one eye or the other eye. Other symptoms that are very common, especially in the Black population, is something called transverse myelitis. And essentially, this is a lesion or spot in the spinal cord that may cause numbness, in the legs. It may cause weakness. People may have numbness or weakness on one side of the body, symptoms that may be similar to stroke. And so again, some of these symptoms can also be very similar to other common symptoms like pinched nerves. But the bottom line is that if you have neurologic symptoms, go see somebody, right? Don't blow it up, don't blow it off, and don't say, oh, this is normal for me to be 30 and not be able to move my leg. Like, that's not normal. Okay. So if you have new neurologic symptoms, you should absolutely get checked out and get seen by your primary care or a neurologist, just to make sure that we know what's going on. One of the things that can also fool you about MS is that the symptoms can sometimes go away, right, in a short period of time. So just make sure you seek medical attention. All right, and then early signs and symptoms, I think we talked about some of those. So again, numbness and tingling, weakness, visual changes. Sometimes people will have imbalance or feel off balance, or people will say, I look like I'm drunk when I'm walking. That can often be a common symptom of MS as well. People can have speech difficulty, but we don't see that as commonly. Okay, and what causes MS is the next question. If I knew that, I'd be a rich woman. I'd be laying on the beach, sipping lemonade in the shade, sharing my knowledge everywhere. But we don't know exactly what causes MS, but we do know that there are several things that increase the risk. There are what we call modifiable risk factors, such as obesity, smoking, and also low vitamin D. And then we have genetic factors, but MS is not a directly inherited disease like, let's say, sickle cell. So with sickle cell, we know if mom has a gene, dad has a gene, we can predict 1 in 4 of the kids will have the condition. With MS, there are over 200 different genes in different combinations. And often the inheritance is very sporadic. So someone will have MS in the family, and then maybe their cousin twice removed will have it, or they'll have a distant aunt that has it. But it's usually not parent, child, or siblings, although that can happen in some instances. So it's a variety of things that increase the risk, but we don't know of the one target or factor that causes MS. All right, and then the last, somebody asked, how prevalent is MS today? So there are nearly 1 million people in the United States living with multiple sclerosis. Up until the study was published in 2019, we thought it was 400,000. So it's actually double what we thought. The projects such as the Registry, the National African American MS Registry, are seeking to help us understand the numbers of Black people with MS, because we don't have good demographics or good information about where people are located who have MS, and then how many Black people in the US actually have multiple sclerosis. There's another question that asks, are there things you can do to prevent MS? So there's really not anything you can do to prevent an autoimmune disease, unfortunately, but certainly doing things like eating a healthy, well-balanced diet, controlling stress, and things like that could potentially reduce the risk for autoimmune disease. But there's really not a specific thing you can do, because many of my patients, honestly, are very healthy otherwise when they get diagnosed with MS. So they may be marathon runners, they may be eating clean diets. It's unfortunately a combination of things that can increase that risk. Is there a special diet to use if a person has MS? The answer is no. But I have patients that use a variety of different diets. So some people do paleo, some people do Wall's protocol, some people do Weight Watchers. I think the main thing is you have to find the plan that's right for you. There are some folks who are doing research that are more focused on diet, but currently the diet that's recommended is the heart healthy diet, which is the Mediterranean diet. So that's the only diet that's specifically recommended for multiple sclerosis. Someone else asked, can you go blind from symptoms of MS? You can. Oftentimes, people do have some recovery of vision if they have that vision loss or that problem we call optic neuritis. But I have had some people that had severely damaged vision related to optic neuritis. Now, there's another condition that's very similar to MS called de Vick's disease or neuromyelitis optica. And so it's similar to MS, but affects the eyes and the spinal cord. Now, patients with that condition are more likely to go blind from their symptoms because the visual changes are much more severe than what we see with MS. So it's not as common for people to go completely blind related to MS unless it goes untreated for a very long period of time. But you can have some visual dysfunction. Let me answer this question about MSDMTs and the efficacy of the COVID-19 vaccine. So this is a super hot topic, which we probably could spend an hour on. So I'll give you the short and dirty, the quick and dirty answer. There are medications that can interfere with the immune response to the COVID-19 vaccine. However, the main thing is to make sure you talk with your doctor to see when's the best time for you to get vaccinated. The time that is actually the easiest for people to get vaccinated is if they're transitioning from one treatment to another and they're off treatment, because obviously your immune system will be kind of back to normal and able to mount a response. But even if the response is decreased, it doesn't mean there's no response to the COVID-19 vaccine. So again, the issue of concern with receiving the COVID-19 vaccine with MS is not that you'll get more symptoms or that you'll have more adverse effects. The issue is that it may not work as well because your immune system is compromised. So always, always go talk to your physician and you all make that decision together. The last question I see here is, how is MS diagnosed? MS is diagnosed by a variety of things. So you see a neurologist, they look at your physical exam, right? We see if we see subtle signs of neurologic damage. We also take your history to see if you have a typical history of symptoms that happen with MS. Often people have symptoms that come on and go away, come on and go away. And then MRIs, right, are extremely helpful. So MRI is really kind of like the money shot to tell us about diagnosis of MS, because we have to have the symptoms plus the abnormal MRI to diagnose MS. And there are other tests that we do in some cases, such as a spinal tap, if there's some concern that the MRI doesn't look typical. And then there are other tests that we can do to look at vision as well, if the MRIs don't look typical or the history is not quite typical. But physical exam, history, medical history, and MRI are the three that are absolutely necessary to diagnose MS. Whew, I feel like I just had a speed round of questions. But hopefully I answered everyone's questions. I'm just going to go in the chat box really quick and make sure I'm not missing anything. Okay. Okay, awesome. Okay, someone asked me about doctors know she had an increase in development of symptoms versus a slower progression that she was experiencing prior to the vaccine. Have I noticed any worsening of symptoms with vaccine? So that's a good question. The honest answer is we don't really know. The majority of my patients in my clinical experience have not had any issues with taking the vaccine other than the side effects that most people have with that second one, like feeling crummy or being fatigued or having a fever, that type of thing. But most of my patients have not experienced a clinical relapse or significant worsening of disease. I think that we will find out more information as our MS registries begin to report out information on people that are actually vaccinated. So there are COVID-19 registries in the US, in Italy, in France. And so they're all over, the world. And I think that once we combine that data and see how people did after vaccine, we'll have a better understanding. But so far, that's not been a common occurrence where I have people who felt like their MS symptoms were worse after the vaccination. And let me see. Let's see. Okay. And then two more quick ones. What do you do if the doctor shrugs you off? I think, it's just like, what was I going to say? I have a good friend and we talk about this all the time. We talk a lot about firing your doctor. And we also talk a lot about what would you do if you got a bad haircut, right? You probably wouldn't go back to the place where you got the bad haircut or didn't do your hair right? But it doesn't mean you won't stop getting your haircut. It means you go somewhere else, right? So if you don't get the answers that you need, it's okay to seek a second opinion. It's okay to seek a third opinion, okay? But make sure that you are persistent, especially if you know that something's wrong. Because I've had lots of people who said, I knew something was wrong and that doctor wasn't listening, so I had to go somewhere else to get what I needed. And then are these self-reported registries. So the COVID-19 registries are, again, across the country. They are reported by physicians. So the patients don't necessarily, there is one registry through I Conquer MS, and it's spelled just how it sounds. They have a website, iconquerms.org, I believe, or .com. It might be .org. So that's the only patient-reported registry that I know of, because they are a patient-driven research enterprise. But the other registries are physicians reporting the symptoms that their patients have had related, or reporting that their patients have had COVID-19, and also reporting the outcomes. Okay, and let's see, I will take one more. I'll take the last one. Is Okravis the drug for relapsing remitting MS? Okravis is a medication for relapsing remitting MS. It is the medication that is used for the Chimes trial, the first minority-focused MS clinical trial, but it is also used for primary progressive MS. So it has two indications. It is the only drug that's approved for primary progressive MS. And yes, the pregnancy registries are self-reported, for the person that put that in the Q&A. So, all righty. I think that might be the end of my time, but thank you all so much for your time and attention. It's absolutely my pleasure. I am always doing things on social media, so if you want to follow me, the Nerdy Neurologist, that would be awesome. But please inform yourself, inform your loved ones, and take control of your health. So thank you so much. And I hope you all have a wonderful day and enjoy the rest of the conference.